Canada. My name is Jackie Madar and I'm joining you from my office in Montreal, Quebec. And on this episode of CanTok, I'm going to talk to you about my 5 tips and tricks for how to do a successful total laparoscopic hysterectomy on a large fibroid uterus. So my first tip is to always make the ports higher so that you're able to have a nice panoramic view, have better visualization, and to be able to reach the uterus from a higher vantage point. My second tip is to use always a 5mm 30-degree scope, which will help you get around those tough corners in order to be able to visualize your vascular pedicles well. My third tip is, if you do have the skills to do so, to ligate the uterines at the origin, which really helps a lot to control blood loss at the time of a hysterectomy for fibroids. My fourth tip is to use a 5mm tenaculum to really help mobilize that uterus, because sometimes you're not able to achieve good mobilization with just the uterine manipulator. And my final tip is I'm going to show you how to put a needle through a 5mm trocar. So what I do is I take my needle driver, I put it through my trocar, and then I attach my needle directly onto my needle driver. And like so, I'm able to put my needle directly in the abdomen, slide in the trocar, and that way you've inserted your needle inside the abdomen without having to use a larger port. Thank you.